got this swelling going on in your ankles. Is that most days? Do you have that?
About half and half.
Okay. Are they pretty swollen compared to usual
Yes.
today?
Mm-hmm.
Okay.
Sometimes they're really hard and sometimes they're very soft, like, I mean, I don't know how to explain when I say hard, but there's no give
Right.
to the skin.
Yeah. Can you see what you need to?
Yeah.
What are you using?
I'm just
Oh,
using.
that's what I used,
Yeah.
yeah.
This, in fact, is called a nail nipper. That's what the instrument is called. So 20 years ago, you had a podiatrist doing this. And,
Not really. I went in because my feet hurt so much.
oh, okay.
Oh, I couldn't walk.
And was that when they told you you had the plantar fasciitis?
No,
Oh,
that happened last week.
oh, okay. And is the bottom of your foot still hurting?
Not now,
Okay, what'd you do for it?
nothing.
Okay.
That kind of seems to come and go.
Mhm.
You know, if it is true plantar fasciitis, it responds best to keeping something with good support under your feet. So that, it looks like you do have that around the house.
Yeah.
Okay. I'm gonna have you just relax your foot. You're gonna give yourself a leg cramp. Just kind of let it go.
The
There.
chair's not the most comfortable chair for her,
Oh, okay.
for her back.
Oh, would it help if I put it back a little bit?
No.
Okay. We won't make you sit there longer than we have to.
No, they're
Okay.
cushioned.
Now, these nails look like they're probably pretty painful in
Mhm.
your shoes, especially these big ones.
Oh, no, they aren't.
They're not?
Those shoes are so comfortable. I don't know if you've ever worn Skechers.
No, I haven't, but a lot of patients wear them
Mm-hmm.
when they come in.
Does she have some type of fungus or anything in there?
You know, possibly, but the only way to truly know would be to send a sample of the nail into a lab and have it tested.
Mm.
And kind of the only reason to do that would be if we're gonna talk about treating it, which in your case would mean an oral antifungal medicine and.
No.
Yeah, and since I don't even know what medicines you're on at this point,
Well, Dr. said that medication is very hard on your kidneys.
well, it can be tough
Yeah.
on the liver.
Oh, liver.
Yeah, but, you know, I've put my own mother on it.
Oh.
I think that you have to be selective who you use it for.
Mm-hmm.
And again, it depends on what medicines you're already taking. So I wouldn't say for sure that these are fungal. Nails can get thick for other reasons.
What we're doing now,
What were you just gonna say?
we're putting Vicks on my toenails.
Okay. You know, the first time somebody told me that Vicks Vapor Rub got rid of their nail fungus, I said, I'm sure it did, dear. And the second time somebody told me that Vicks Vapor Rub got rid of their nail fungus, I said, I'm sure it did, dear. And then I saw an article in the New York Times that actually talked about what's in Vicks that has known antifungal properties. So there is some science behind it.
I had the exact same reaction, and I saw the exact same article, and I told her, yeah, people had results. It takes a long time.
Mm-hmm.
We used to go to Florida every winter,
Mm-hmm.
spend a month, and I subscribed to the Naples newspaper.
Mm-hmm.
And there's a retired doctor who writes for the paper,
Okay.
and he mentioned Mirapex, and I thought, "Ah, if that works, and it does,
For what?
restless leg syndrome.
Oh, yeah, it's used a lot. Mm-hmm.
And then he wrote about if you have this, whatever it is, instead of using expensive medications, yada yada.
Mm-hmm.
He said just use Vicks.
Yep.
So, I don't know if we're
But you know,
using it
for a lot of
properly.
people, yeah, for a lot of people, it's not a good option because they know they're not gonna be consistent putting it on every day for a year. You know, but if you know that you will be, then it certainly can't hurt to try. Unless
Well,
people.
that's sort of how I feel, it can't hurt.
Right, well, unless your friends start to stay away from you because of the smell, you know.
When you get to be my age, that's really not too much of a consideration.
Am I to take that to mean you have no friends or they just don't have a good sense of smell?
No good sense.
Well, you gotta make younger friends.
Yeah.
Do you live in your own home?
Mhm.
Okay, relax your leg again.
Oh.
What made you decide to go into podiatry?
Oh, I was going through all my med school interviews and I ended up as at a podiatrist as a patient. And he said, have you ever thought about podiatry? And I said, no. And he said, well, why don't you come spend some time in my office? I think you'd have fun.
Yep.
So I spent some time in his office, and that was 35 years ago. So he was young, and he was right out of his residency. And at that time, he was raking in the dough. But mostly it was that he had fun every day that he went to work. And, you know, it was medicine and surgery, but mostly not life and death stuff.
Mhm.
And so I ended up applying to podiatry school as well. And I got into an okay medical school, but I got into what was at the time the best podiatry school in the country. So I withdrew my medical school acceptance and went podiatry.
Oh, it's not the same? I didn't realize they had different schools.
Yeah, it's kind of like dental. You know,
Oh.
they're very similar. The first
Mhm.
couple of years they're identical, but as you get more advanced, you specialize more and more. So. Like, there's no reason a dentist has to do an OBGYN rotation,
Right.
you know, but we all do psych, we all do anesthesia, we all do radiology. So.
Well, this is the first time I've met a doctor who has fun.
Yeah.
It has fun?
Yeah.
Fun in the office.
You know, if more doctors were able to stay in private practice, more doctors would still be having
I
fun.
bet, yeah.
I control my schedule. And I don't have to see 7 patients an hour.
And I'm back spend 10 out of the 15 minutes on the computer.
Are you gonna paint your nails too?
No.
tool's pretty amazing.
Yeah,
So
Can
I just
you-
wanna draw your attention for a second
Okay.
to, like, all of this skin under here.
mm-hmm,
This skin, if I were to try to cut it back, would bleed. And so now that the nail is off of the top of it, it'll
Mhm.
dry up and it'll kind of recede,
oh,
okay? And then I'll get those calluses for you too.
I was wondering why that was like that.
do I have any, or can you examine to see if I have any sores on my feet?
Yeah, I haven't seen any so
Oh.
far.
Good.
Just just a callus, one callus or multiple?
No, I just see the one here. And that's about it.
Mm.
I don't see any others. Now, you know, I know that your PCAs have been doing your nail trimming and stuff,
Mhm.
but because your circulation isn't great in your feet, that's a qualifier for Medicare to cover you to come in here every
Oh.
couple months.
Oh,
So
okay.
people come in about every 2 to 3 months to have this done. And then you'll have somebody checking your feet every couple months
Oh,
and
good.
and then, you know, and then it's one less thing that you have to worry about at home. So a lot of these toes had the skin that came up underneath where the nail was. And so we're not gonna cut it back, but it should kind of dry up and resolve on its own. So, any questions about anything?
No,
Okay. Do your PCAs, do they check your feet every day?
We've been putting the Vicks on there.
yeah,
Okay.
And we were putting lotion on her legs
Okay, good.
for a little while.
Okay.
And I mean, we noticed that the swelling
Mhm.
kind of comes and goes in her ankles.
Mhm.
But but we don't know what we're looking for. Doesn't ever look like there's anything obviously wrong with their feet, but if there's something we should look for.
No, you know, it's just a question of looking frequently so that if something looks very different, you'll know it.
Okay.
And making an appointment to come in to have the nails trimmed and the callus trimmed every 2 to 3 months, that doesn't mean that if you think that there's something going on that you can't come sooner. So,
now the skin on my legs,
very
Flakes
dry.
off.
Yep, very dry. So keep lotioning it.
okay?
And, do you have socks on today?
Nope.
No. Is there a lotion that we should be using that you
Um,
recommend?
You know, any lotion that you put on every day is the lotion you should be using.
Oh,
Okay, I use Lubriderm just because I can get it in big bottles from Costco. But anything around that price point is good. Just use it every day.
okay.
Thank you for letting us video.